Now, the top pediatrician group in the country is denouncing HHS's declaration that gender-affirming care poses a risk to children's health and well-being. Federal health officials announced a proposed series of actions Thursday to limit gender-affirming care for minors, potentially affecting multiple agencies, including the CMS, FDA, and OCR.
The American Medical Association, the American Academy of Pediatrics, peddled the lie that chemical and surgical sex-rejecting procedures could be good for children who suffer from gender dysphoria. They betrayed their Hippocratic oath to do no harm. So-called gender-affirming care has inflicted lasting physical and psychological damage on vulnerable young people. This is not medicine, it is malpractice. We're done with junk science driven by ideological pursuits, not the well-being of children.
Now, the American Academy for Pediatrics says allowing the government to determine which patient groups deserve care sets a dangerous precedent. For more on this, let's bring in Executive Director at the National Center for Transgender Equity, Rodrigo Heng-Lehtinen, and Clinical Professor of Pediatrics at Stanford Medicine and Children's Health, Dr. Morissa Ladinsky. Rodrigo, I want to start with you. What does this announcement mean for transgender minors?
Well, thank you so much for having me. And this announcement is of enormous significance for all transgender young people, regardless of whether or not they actually take any kind of this medication. I work also at the Trevor Project, where we staff a 24/7 suicide prevention line for all LGBTQ young people. And our counselors regularly hear from young people who are worried, who are scared, who are anxious, because what they're hearing from all of these headlines is that the adults in their life don't care about them, that the government wants to prosecute them. So this goes far beyond specifics of healthcare policy, and this gets into sending a message to everyday young LGBTQ people across the country who are worried about not being supported by the people in their lives. Now, healthcare policy is complicated, I get it, but I think we can all agree that if it's going to go, if our rhetoric is going to be so heated as to make the young people in our lives feel unsafe, it's gone too far.
Now, Dr. Ladinsky, HHS Secretary RFK Jr., says gender transition treatments are neither safe nor effective for children, and that there's an overwhelming body of evidence that these procedures hurt rather than help children. What's your response to that?
Well, again, I thank you for having us and for elevating this concern, because this really is a concern to everyone's health care. HHS labeling evidence-based, longstanding medically necessary care as malpractice could not be farther off the mark. This care has been in place for decades, and the evidence and science behind it have not changed. Thus, the endorsement, as you saw earlier by the AAP and many other major medical groups, has not changed. What has changed is this department's unprecedented, never before seen decision to ignore it.
Now, Rodrigo, can you tell us about your own experiences as a trans man? How would your life be different if you didn't have access to treatment for your own care?
Well, I'm a transgender man, which means that I was raised as a girl and then transitioned to live as the man that I know myself to be. And I happen to have started my transition when I was an adult, when I was 21, but I was trans before that. And when I was figuring out who I was, it was really hard for me to access any kind of support or resources. And because society was consistently sending this message that there was something shameful about being trans, that you shouldn't be proud of yourself and that there was something to hide. So if I, as a young person, had had the opportunity to speak openly, to confide in safe adults in my life, to get that kind of support and acceptance, I would have been so much happier. And now I'm really fortunate that my family did accept me when I came out as trans, and I thank God for that every day. But but I worry so much about the young people just one generation behind me, who are now reading these headlines every day. I cannot imagine how hard it would be to, I think we all remember what it was like to be teenagers. It's hard to figure out who you are in the best of circumstances at that age. I can't imagine now if my very experience as a trans person was being openly questioned by the federal government. It makes it that much harder for a kid to figure out who they are.
And Dr. Ladinsky, the House has also voted to criminalize gender transition treatments for minors like surgery or hormones. What would that mean for doctors and patients if that were to become law?
Well, we will hope it does not, but let's take a step back and look at what this entire conglomeration of bills and orders is threatening to do. It's a threat to everyone's healthcare and to tomorrow's doctors and people who are choosing this profession. That's threatening. But this administration is using, in addition to the hand of law, the threat of bankrupting hospitals to rip essential healthcare from families and young people. We're pediatricians. You heard Rodrigo speak of the love of his parents. This administration has stood up boldly for parent choice, but these laws and these acts would strip parents of their choices and voices as they make medical decisions with us, pediatricians, on behalf of their children. So this is a call to action around this country.
Executive Director at the National Center for Transgender Equity, Rodrigo Heng-Lehtinen, and Clinical Professor of Pediatrics at Stanford Medicine and Children's Health, Dr. Morissa Ladinsky, thank you both very much for speaking with me.
Thank you for having us.